Good afternoon, Premier. Good afternoon, Prime Minister. This is Prabnoor from Parvasi Media Group. So the foreign trained workers who are coming to Canada, they have to qualify themselves separately for each province since all of them have their independent healthcare qualification system. And this leads to so many trained doctors leading to doing odd jobs while the country is facing healthcare problems and shortage. Why do we not have a national level program to absorb the foreign trained workers and doctors in Canada's health system and recognize their credentials at a national level?
Thank you very much. And it's a really important question. As Canadians are continuing to struggle to access the level of services in healthcare systems across the country, and as we welcome in people from around the world, many of whom have medical qualifications, it's important that we're able to deliver those health services to people right across the country. We are having conversations with the provinces around accelerating licensing and credential recognition. The federal government doesn't deliver healthcare. We work with the provinces to support them as they deliver healthcare, but the federal government does have a role in coordinating and making sure that any Canadian anywhere across the country gets a sufficient level of access to quality medical care. That's something that we do for the Canada Health Act. So part of these negotiations that we're embarking upon with provinces like Ontario around the healthcare system will be around ensuring that we're giving the best support to our frontline healthcare workers, which includes making sure that new waves of people either coming through our medical schools here or coming to Canada to keep Canadians healthy are able to do their jobs in the best way. But it's an ongoing conversation in which both federal government and provinces agree we need to make real advances and solve this, and this is what we're working on together. But I'll pass it over to Doug for the Ontario perspective.
Thanks, Prime Minister. So we're working collaboratively, as the Prime Minister said, with the federal government, trying to expedite not only medical folks that have the background, be it a doctor or nurse, but other sectors as well. And I know we have our both ministers of health sitting in front of us. Just to give you an example, over the last 4 years, we brought on 8,000 doctors. We're working with the regulatory colleges to make sure we expedite the doctors right across the country. By the way, the Minister of Health, Mr. Jones, made a great announcement that we're going to be able to expedite doctors, be it in BC or Nova Scotia or any other province or territory, into Ontario a lot quicker than we had before. But again, we're going to work collaboratively with the federal government to make sure we expedite as many people as we can, not just in the medical background, but other areas as well. So thank you.